hospital. But other than that, the role of the national government in the Republic of Kenya basically is, and especially in the Ministry of Health, is creation of policies and ensuring that there is training of healthcare workers. That is why today I have something good for you. And for those who have got the newspapers for today, I want you to turn to page 11 of the Daily Nation. And there is an advert, there's a public notice there, a very big one, half of the page. There's a public notice. On the left side is the SHA. SHA has declared vacancies, and on the right side is what I want to talk about. Public notice, call for comments. It's on this page. There is call for comments and invitation for public health participation for the Kenya Healthcare Professionals Policy 2026. I repeat, Kenya Healthcare Professionals Policy 2026. You know, some things happen and we think they are normal. It's normal. But I want to tell you that we have never had a healthcare policy for Kenya, for professionals, healthcare professionals policy in Kenya. This is gonna be the first one. And the good thing is, we know the gaps. We know what the issues have been. So we have gone ahead to give the objectives, that this is to strengthen and operationalizing the existing human resource for health governance and coordination. There are quite a number of issues that we noted as we were thinking of how to come up with this Kenya Health Professionals, Healthcare Professionals Policy of 2026. The first thing is the coordination and governance and partnership. We realize there is very weak coordination within national government. Remember, health is a devolved function. So that coordination needs to be worked out when an officer wants to move from one county to the other, inter-county coordination of officers. How do we go around it? And between government and agencies, you don't know who is doing what. So to strengthen this policy has to be in place. The other thing which is also exciting about this policy is the strategic planning for financing. Just to make sure that there is suboptimal planning, forecasting and financing for, professionals at the lowest level, and this is going to strengthen this strategic planning for sustainable financing, and especially for healthcare workers. Remember, our role is equally to train postgraduates. We do postgraduate training. Wale madaktari wameshatimiza na wako kazini, pia tunawahimiza, the government has money to take you for further training, and not just doctors, but any other cadre along across board. What we are doing right now is to ensure we have the needs assessment from the county government. We want to know, we do not want to train simply because we want to train. We want to train you. You come from Tana River County. We want to train you to be a gyna. You go back and serve the people of Tana River County. We want to train you on oncology because you come from Kisumu, but you must go back there because there is need. I'm just giving examples. So again, ensuring that budgetary allocation for training, for recruitment, for deployment and retention is mapped out. Development and implementation of strategic and investment plans. The county governments will have to mainstream the priorities in their county integrated development plans again, and also the establishment and institutionalization of maybe predictable innovation. Like now we have in the Ministry of Health, we already have the health, digital health superhighway. So at a click of the button, we can tell you that Dr. A is in this facility, this is his number, this is the last time that he did an operation, and to who. through the digital superhighway. Now, the next thing that we realized is on education and training. Now, the lack of coordinated and strategic planning in education and training to meet the population health needs. I think it's in line with what I've just talked about in postgraduate training, that initially we would wait for anybody who wants to go for postgraduate, and you see we have the budget for that, and we would allow them as long as there is no objection from the county government. But now we are saying we will train because there is a need, yeah, and we will also train not just for local, but we will also train for labor mobility. So development of and operationalization of master healthcare professionals framework, and enhancement of mainstreaming of education and training for healthcare professionals that is based on the population and equally the health services that are being provided. The other thing that which should be interesting for you is equitable distribution. I know there could be areas in our country that we do not have a consultant. For instance, for anything, any cause of ailment, we may not have consultants. Then why can't we train specifically that consultant that is required for that particular county to cover either the specific county or cover the broader area of that region. Right now we have several oncology hospitals that are coming up. We have Meru that may be upgraded to that. We have we have Kisii, and we have Mombasa. We have Nakuru. So if there is an oncology center in a certain area, say Rift Valley, Nakuru, then Nakuru Oncology Center may cover Bomet, may cover Kericho, may cover the areas that are there, and you can have 2 or 3 consultants that are taking charge of that. So equitable distribution, so that we do not have most of the healthcare professionals just working in towns, and then where we really need them is actually our country, not in Nairobi, not in the big hospitals that are in Nairobi, but we need them at the bottom of the pyramid. Now, we also want to strengthen and streamline issues of legislation and regulation, the gaps that the overlapping gaps that are there, and around the regulatory framework for healthcare professionals. That is self-explanatory. I don't want to go into the pain points that we are having, maybe Ministry of Education, Ministry of Health. We want to clarify and rectify all this. And finally, the healthcare workforce migration is very important to optimally utilize this by ensuring that there is promotion of structured migration through evidence-based planning, development, and implementation of legislation and regulatory framework. So why do we have the public notice today? We are calling upon comments and invitation for public participation. Kama wewe unajisikia uko na kitu, you have something to add on top of whatever we have already drafted, please appear. We have clustered the counties, and it is starting on the 14th of April. Ensure you appear at Semara Hotel in Machakos. There is Eka Hotel in Eldoret, Sapphire Hotel in Mombasa, Palm Oasis Hotel in Garissa, ACK Hall in Kericho, Nuru Place in Nakuru, Jumuiya Hotel in Kisumu, Golf Hotel in Kakamega, Meru Slopes Hotel in Meru, and MS Hotel in Nanyuki. Do not hesitate to give information that is going to help all of us. And finally, I just want to keep encouraging you that public health issues must be observed, the highest level of hygiene must be observed as we prepare our food. Whenever you want to deal with these issues, sanitation, please ensure that you observe the highest level of hygiene. I'll be coming much later because I have quite a number of things. I have seen the media asking me about food safety issues. I have a whole lot of things that I want to talk about that, and issues nutrition, and also packaging and emanating new emerging issues that are cropping up in the market that are affecting us within our ecosystem in regards to public health. So I will end it there, but hopefully I'll be able to come back before the end of today because I have quite a number of packaged issues that need to be discussed openly and be able to give information. Lakini wa Kenya, wacha niwaambie, there is a lot that is happening in this country, and for the good of the citizen of this country. And one is within the healthcare space, others are within the Ministry of Agriculture. I've seen my colleague has actually announced that my colleague Rono has announced that this consignment that will be transported via SGR to Nairobi around the fertilizer, and this is a good thing for people who are farmers, or for our farmers in the country. Therefore, I want to urge you that let us not politicize development. Let us be ready to listen and be part and parcel of the engagement that is happening across the country. I want to call upon all Kenyans that should there be an idea that you have which you think is much better, then we are always ready to listen. We are always there to hear you. We are always there to make sure that things are getting better for us every other day. And I want to tell you, and this is a fact, hakuna mgonjwa wa neighbor na wako. Mtu akigonjeka ni mgonjwa. Hakuna mgonjwa wa county na wa national government. Mgonjwa ni mgonjwa. And that is why we need to save this space. We need to secure this space and ensure everybody is happy. See you later, guys. I know I will be coming back later. Wacha nifanye kazi kidogo and then we'll connect later.